Hey everyone, welcome to the Nursing Insights podcast. My name is Stephanie and I'm a registered nurse practicing in the state of New Jersey. Getting right to it, the state of healthcare right now is tough, to say the least. Let's just say that the nursing shortage does not spark joy. We can sit in that and stew in it for a while, but we can't live in it forever. Things are changing. So join me as your host as I partner with the New Jersey Collaborating Center for Nursing to find out what's going on in the state of nursing. In today's episode, we'll be talking with Kaylee Hammond, a medical surgical nurse at Capitol Health. She just finished up her first year of clinical practice and her nurse residency program there. Let's get started.
Kaylee, welcome to the podcast. Thank you so much for joining us. I understand that you're a registered nurse from Rowan University. Could you tell us a quick bit about your background?
First of all, thank you so much for having me. I'm so excited to be here and to talk about nursing. Before I was a nurse, I was a massage therapist. So right out of high school, I went into massage therapy and I did that for about 10 years. And in high school, originally, I actually wanted to be a nurse. I took anatomy and physiology and hated it. Never wanted to see any textbook ever again having to do with the human body, which is funny because going to massage therapy, I ended up taking it again. And it was a lot better the second time. So then I was in massage therapy and I was like, I kind of maybe am ready to try nursing again. So I went to nursing school at Browning County Community College, which is actually partnered with Rowan currently. And, I just really loved it. And I chose the hospital that I chose, Capitol Health, because they have a nurse residency program that had a lot of active shadowing. So what active shadowing means is that you actually go to different units and get to see different nurses and how different units just kind of operate together. So it was just so much fun just to see everything because I'm kind of a nosy person. So I was like, now I feel like I know every single thing that's going on in the hospital, which is not 100% true, but maybe more true for me than for somebody else who didn't get that experience.
Oh, absolutely. Being able to see with your own eyes and being able to interact with the nurses, I think that's one of the highlights of nursing school for me as well, to just learn, to just go out there and to explore and to engage with people and with nurses from all over the place. So we do know that you ended up choosing and selecting a med-surg residency. Could you tell us a little bit about what drew you to med-surg?
So again, with the active shadowing with the nurse residency program, is originally I went in really wanting to do mother baby or labor delivery, which the program does not guarantee a spot on like a specialty unit, but they do guarantee you a spot on the med-surg unit. So you will have a job after your rotations. And just as I went around the hospital, I could just see the value in having a broad background. And I was just like, I just really want to learn so much and more about nursing than what I could just see in mother baby or labor delivery, even though I just absolutely love that specialty. That's probably my favorite. As I was going around, as I was seeing different things, I kind of landed on more of a med-surg floor with a focus on surgical, which I think, considering my background as a massage therapist, is not surprising because a lot of it has to do with pain. So before I kind of worked with people who had chronic muscular pain, and now I see people in acute pain after surgery, which is very uncomfortable and something I'm also familiar with because I have had surgery before and it's not fun. So
that must give you such a lens of compassion by having that experience as a patient. So thank you for the work that you do as a med-surg nurse. Also, for any of our listeners who are not familiar with the concept of med-surg or who haven't practiced yet, could you explain a little bit about what med-surg is and what it stands for?
Medical surgical nursing is what I like to call personally like a catch-all for everything. Patients that are not so severely ill that they need to be in an ICU or like a step-down unit that are more closely monitored, but maybe they're there post-surgery, pre-surgery, maybe they have an infection that requires some IV antibiotics where like pills aren't working at home. Maybe somebody's there because they're testing a new medication and need to make sure it works. They have a blood clot. Like it really is just a catch-all for everything. So most of the time, unless you have a family member that is giving birth or in the ICU, they are on a med-surg unit.
Yes.
They're hanging out with me.
Absolutely. Absolutely. So med-surg, really, like you're saying, you can see anything and everything under the sun, which is, I think, one of the reasons why I also started in med-surg. I stayed there for 5 years, and I feel like you get to see so much because nothing is nothing is handed off to a med-surg nurse, that hasn't been seen before. It's a huge, huge variety and breadth. So being in the med-surg field, where is it that you physically work? I'm assuming the hospital setting?
Yes, I work in the hospital setting, acute care. In particular, I work on a med-surg unit with a focus on post-surgical for the most part. So we see chest tubes, GI surgeries, back surgeries, knee surgeries, hip surgeries, which I find, again, super interesting just because of my interest in pain. And then even I will say in our hospital, there are multiple med-surg units, and they all tend to have a focus, whether it's stroke or oncology or tele. So I think sometimes people are like, oh, if I'm med-surg, I really do see everything. And nowadays, because people have so much going on, there really is specialties within the med-surg units.
Yes, absolutely. So coming into med-surg and seeing the variety of patients that can walk into the doors, and also, understanding the variety of care, because you might have a surgical patient in one bed and a medical patient in another bed, all with different conditions. How do you feel that being a med-surg nurse has formed you in your nursing practice, or what skills has it developed in you?
I think just in general, you see more, so you learn more. You can learn everything in school, but it's so different seeing it on a real person, which I think people get kind of an idea of during clinical, but definitely being a nurse full time, you really are like, oh my gosh, it really is different than just book learning in school, which is valuable and helps set you up for being on the job. But yeah, no, I think you just learn so much because you see so much.
Yes, absolutely. And then kind of related to what you're talking about, learning and seeing, how do you feel like being in a residency program specifically for med-surg? What was that experience like for you, and how did that help you?
So our residency program, I think I've said it a couple of times already, it starts off with the active shadowing and the going to different units, which is helpful because by seeing different units, maybe you kind of go to a unit and you're like, I just like the vibe of this unit. Not even sometimes I like what I'm seeing, but I like the people I'm going to work with, which is so important and so valuable. You're like, oh, I really click with this manager, this team. And then the second part is, as you continue to go through the program, once you pick your floor, they will have classes and everything. Classes which focus on self-care and time management. And maybe even at one point I had suggested, I was like, heparin's a really hard thing and there's so many complexities to it. Could we have a class where we just focus on heparin? And that was actually something that the coordinator of the program loved and ended up putting it. So yeah, I think it just provided a lot of extra support for a new nurse.
Yeah, that sounds like the case. That's wonderful to hear. Every new nurse faces an abundance of challenges. Did you feel like you found any particular challenges in the med-surg space that maybe you wouldn't have found elsewhere?
With med-surg, you do have between 4 to 6 patients, and I am a night nurse, so we'll have up to 6 patients. And I can only say this about my hospital and the unit I'm on. I can't speak for all hospitals in this area, but from what I hear, that's very typical. And so I really do think you get a lot of time management. You really have to look at your day and be like, what's the most important thing? What do I absolutely have to do for this patient? What meds do need to be given right away? Or what tasks do I need to do right away? Versus, okay, there's things that need to get done, but it can kind of wait until a little bit later in the shift.
Based off of what you're saying, would you be able to paint us a little story? Tell us, what is a day in the life of a med-surg nurse like, walking onto the floor? What kind of cadence, what kind of flow do you have?
So mine, it'd be a night in the life.
A night in the life of a med-surg nurse.
Yes, I work night. So normally for me personally, I try and get a nice, good nap in before my shift. It's definitely harder the shift going in than the next shift, if that makes any sense. And so I try to get my nice nap in. I'll pick up a coffee or tea or something to kind of get me going, get a meal with lots of protein, get to the floor, write down the patients that I have, take a peek at their orders and whatnot, just so I kind of have an idea of what's expected of me during the shift. I'll get report from the other nurses. And then as I'm getting report from the other nurses, we're saying hi to the patients. I'm asking them how their day was, seeing how they're doing. And then from there, it's in the very beginning of the shift, it's kind of getting everybody settled with their night meds and pain meds. And because it's a surgical floor, normally people will go to sleep, but then they tend to wake up around 2 or 3. You need to go to the bathroom and needing some pain meds and just kind of, again, getting them back settled and then passing the morning meds around 5, 6 o'clock in the morning. And then it's shift change and then I'm heading home.
Of course, there's a lot of things that can happen between night meds and morning meds. That's a whole evening. And, the landscape of the hospital, I'm sure, is very different from the daytime to the nighttime. Overnight, what other healthcare professionals do you tend to work with or collaborate with?
Yeah, so overnight we'll work with respiratory therapists and the nocturnalists. And really I lean on like the other nurses on my floor. So I've heard like day shift nurses say this to me. They're like, when you work nights, you really work as a team with your nurses. They're like, with days, there's so many more people collaborating. So sometimes you don't get to know each other as much.
And actually, that was one of my other questions. Is where do you feel like in your practice you have the most autonomy? And where do you feel like you end up collaborating the most?
In my practice, I feel like I have the most autonomy and kind of being able to, you see surgical patients often, so you kind of know what problems tend to arise. So for example, after a lot of our patients have GI surgeries, they tend to have really bad gas. And if you don't know, if you are unable to get up and walk around, and then if you're unable to go to the bathroom, sometimes having a lot of gas will make you feel like you're maybe about to die. And then people will be like, oh, I feel a lot of chest pain. And then we will then call a rapid response because chest pain is very serious and needs to be addressed right away. And I've noticed that if I get my patients up, walking around, going to the bathroom, kind of educate them about like, oh, you might be experiencing gas pain and whatnot, we tend to not see those as often, which that's just something that I've noticed. Like, I'm like, okay, if I practice with autonomy and I'm kind of staying on task and kind of moving people around, people tend to do a lot better.
Yes, that is one of the key beautiful parts of being a nurse is the stuff that you do on a daily basis has actual impact on the pain, on the lives of the people that you're working with. So that is just awesome to hear. And what areas do you tend to collaborate with, whether it's the physician or the respiratory therapist? Where in med-surg do you see a lot of collaboration?
So definitely we'll see a lot of collaboration with, sometimes if somebody needs, maybe they're like, oh, something just doesn't feel right. You're kind of taking your vitals. I'm checking with the other nurses, say like, what do you think about this? I will be like reaching out to the hospitalist or whoever their care is under, being like, hey, something's going on with this patient. I'm not quite sure what. Here's some tests that I think we need to run because this is concerning to me and I want to make sure they're okay.
I mean, it's important to have a team you can trust and you can reach out to. It sounds like you have that. Why do some people suggest, from your perspective, that new nurses work in med-surg for a few years before continuing on into a specialty? And do you have any thoughts on that?
From what I've heard people say to me is I think it just provides this broad background. So you come into it just kind of, you go into specialty maybe knowing more. So for example, I know people would say to me when I was interested in going into mother baby, they're like, the nice thing about having the med-surg background is that you come to us just with lots of knowledge on different medical conditions, different, like how maybe you're more familiar with putting in IVs, maybe you're more familiar with what to do with chest pain where we don't see that as often. And just to kind of, you're more comfortable with time management because again, like on the med-surg floor, you just see so much where people would say to me, it's being within mother baby, maybe you don't see as much as fast. So it takes you longer to pick up on things. Mother baby nurses are fabulous. And what they see, they're very, very good at. And I don't want to take that away from them.
So my final question for you is, how do you see med-surg nurses change lives?
Again, in particular on my floor with surgical patients, is sometimes I have people before they're going to surgery, maybe they came in just because one of their lab values is off and they just want to the doctors want to do some check-ins or they want to like wean them off a drug, but they want to do in the hospital where it's safer. And a lot of it is just like talking to people before surgery, like, hey, it'll be okay. This is what you expect. And just kind of seeing somebody be like, oh, you know what? Going into surgery, I was much more relaxed because I was talking to you. And then even after surgery, people will tell me, they're like, I felt really comfortable with you. I felt like I could sleep all night. Or even from patient family members, oh, I felt so comfortable leaving you and my like family member with you because I knew you'd take good care of them. So I think it's just, providing comfort and being like, I trust you and I trust you to take care of me, which puts you on a good road to recovery.
That is so beautifully said, Kaylee. Thank you so much.
In the next episode, we'll be finishing up our conversation with Kaylee by getting to know her, not just as a nurse, but as a person. See you next time on the Nursing Insights podcast.
This podcast is brought to you by the New Jersey Collaborating Center for Nursing and the Rutgers School of Communication and Information.